It's a scene that Julie Rose and her husband Keith feared they would never experience. A simple day at home with not just one, but two of their own babies. Their world now revolves around the twins.
They are 6 months old, and their names are Andrew Richard and Jenna Mariah.
Both in their late 30s, the Roses had been trying to have a baby ever since they were married 11 years ago. Conception was not the problem. Julie was simply unable to carry a child for more than a few months. After 4 miscarriages, her infertility specialist, Dr. Brian Berger of Boston IVF, recognized a disturbing pattern.
The vast majority of miscarriages and the vast majority of patients that we see with recurrent miscarriages are due to chromosomally abnormal embryos. Our working diagnosis for Julie was that the embryos that had miscarried were most likely chromosomally abnormal, and so we decided to do PGS, pre-implantation genetic screening.
Up until a few years ago, doctors were only able to screen embryos for a limited number of genetic defects. But a company called Gene Security Network has a new test that allows doctors and patients to get a more complete picture.
The newest technology enables us to actually test embryos prior to transferring them to a patient, and we're able to actually test all of the chromosomes. So there are 24 chromosomes for human beings, and we can actually test all 24 chromosomes to make sure that they are all present and normal appearing.
There were 4 normal embryos out of 8, and when I found out I was pregnant, it was very exciting. I felt I had the confidence because the embryos were tested, and every time I went for a checkup, my appointments went smooth, everything was okay. The babies were growing normally.
The cost of the procedure can be as high as $9,000, and many insurance companies do not cover that cost. However, in the future, pre-implantation genetic screening will be able to detect a multitude of specific disorders.
There's hundreds of disorders that we can potentially screen for, but the number that we can screen for at one time up till now has been very limited to just one. With the new technology, we'll be able to screen a panel of disorders, which hopefully will be as many as 50 or 80 or maybe even hundreds down the line.
The Roses were fortunate. The procedure was covered by their insurance company. But Julie says even if they did have to pay, it would have been well worth the money and the time.
Hey! It was worth all the time that I struggled. They're just precious and wonderful, and they're miracles of God.